Moving further to the third lecture of CME, I would like to call Dr. Dinesh Bhutada, who is going to enlighten us on medical legal aspect in sexology practice and sexual dysfunctions. Dr. Dinesh Bhutada has completed his MBS from GMC Nagpur, DDB from Solapur Bhati Hospital. He is a renowned dermatologist, gynecologist, cosmetologist practicing in Permani since last 20-25 years. He has also done his LLB and is a medical legal consultant. He is also author. He is also editor of 4 newspapers, Saundaryagata, Scandinavian Times. So he will be throwing light on medical legal aspect in sexuality practice and sexual dysfunctions.
You have seen first time, I think, son is introduced to father. But the soon time will come, father will introduce the son in further 2 years. My talk is on the medical legal aspects in sexuality, practice and sexual dysfunctions. Navigating legal, ethical, professional responsibilities in sexual healthcare. First one, dermatology. Then trichology has introduced to the dermatology. Then further lasers and aesthetics. And now this sexology is also introduced to the dermatology, and each and every dermatologist must know all the streams of sexuality, their laws and related to that. I am doing this talk because I have also completed my LLB. I am sharing this with my Dr. Jagdish sir also completed their LLB, and in future will be the medical legal consultant of all dermatologists. So, in the table of contents, an introduction, legal definitions, informed consents will go further one after another. Regarding introduction to medical legal aspects related psychological and physiological issues, practitioners must understand medical legal aspect to navigate complex legal responsibilities, protecting patient rights, doctor rights, and ensure ethical care. You all know about the human sexuality. We are in the era of Generation Z. You have seen what happened in the Nepal. This Generation Z has given us a new community that is called LGBTQ+. May I know anybody are knowing this about this LGBTQ+? So this new community has come in this era, and until and unless we understand this community, now hereafter we have to understand this community and we have to solve their problems. This importance of legal knowledge in sexuality to avoid the legal pitfalls. The ethical care in sexuality should be done that helps practitioners protect patient rights and efficacy. In legal definition and frameworks, there are some key terms regarding sexuality, consent, confidentiality, then governing frameworks. We must know healthcare laws, privacy acts, sexual health regulations. In jurisdictional differences, there are state-wise, country-wise differences of law regarding this. We should know all that, and that's the impact on the clinical practice. So first and most priority is the consent. This consent is important in dermatology, everywhere, but this has more importance in the sexuality. Informed consent in sexuality is fundamental. It should be clear, comprehensive, information about treatment and interventions. We have to take the extra caution regarding minors. When minors comes with their parents give the consent, and at the same time we deal with the parents and the minors. But minors' confidentiality is to be maintained with the parents also, and this is a big task for the doctors. In legal implication of consent, legally protects the patient autonomy and practitioner liability. Regarding comprehensive information sharing, patient must provide with detailed explanations of procedures, ways, and alternatives. This transparency fosters trust and supports informed decision making. So, first and most important part in to avoid medical pitfalls is the informed consent in the sexuality. Another is the confidentiality and privacy law. This is very well required for the medical legal people who is doing clinical sexuality patients. Confidentiality is a legal and ethical mandate to protect patient information. Practitioners must ensure sensitive data should not be disclosed, except if there is a risk of harm to self or other or child sexual abuse. In sexuality practice, confidentiality and privacy law is to be maintained properly. Otherwise, patient may sue in the court of law. Regulation of sensitive data. Privacy law regulates how sensitive sexual data and it is to be stored, shared, disclosed, encrypted. These laws aim to safeguard individuals' personal and health-related information. These are the ethical considerations in sexuality practice. We have to work for the packaging prevention, where unqualified practitioners exploiting patients. We have to look for the informed consent ethics. We have to see for the unproven therapies, use of experimental or non-evidence-based treatments in sexuality, and also professional misconducts which decide the sexual boundaries. Reporting. First, we have seen the consent. Second, we have seen the privacy and confidentiality, and now reporting. Each and everything should be reported to avoid the legal pitfalls. There are some mandatory reporting. Legal mandatory reporting. Practitioners must report suspected abuse, exploitation, or harm as required by the law. Failure to report can result in legal penalties. So we have to do all the reportings properly. Whenever court is required, we have to produce that also. And in failure to those reportings which we fail to convey to the court government and which are harmful to the society, then the doctor is liable for the penalty. Protecting patient trust. Understanding when and how to report is crucial to comply with legal mandate. Consequences of non-compliance, as all of you know, failure to report, you can result in the legal penalties. Sexual dysfunction and medicinal use. There are off-label drugs which are used in the sexuality. Off-label use of drugs like PDE5 inhibitors, hormonal therapy, shall be justified, documented, and explained to the patients. This PDE5 inhibitor drug is mainly used in the pulmonary hypertension for the vasodilator, as a vasodilator. But many times this drug is that is a label indication in pulmonary hypertension, and this is the off-label indication in the sexuality. So this is to be properly explained to the patient. If you are not explaining him, then you will he can take you to the court of law. Importance of legal compliance. Failure to warn of adverse effects can cause neatism, infertility, psychiatric effects, and negligence claims. So all off-label and on-label drugs you should know, and accordingly you will treat. Psychology and sexuality. These are the two people went together. Psychology discuss sexuality, sexuality discuss psychology. Psychology and sexuality in many cases involve mental health aspects, paraphasias, gender dysphoria, compulsive sexual behavior, and medical consideration, misdiagnosis, inappropriate labeling, or insensitive handling may expose the practitioner to legal action. While giving certification for gender reassignment, infertility, or sexual fitness should be based on the established protocol. Marital or relationship issues. Certificates and medical consideration in all cases of marital and relationship disputes. Viewer one certificate may then unite or may then divorce. So be careful while issuing the certificates. And while issuing certificates, you have to be very prepared with all documentation of what you are writing in that. Practitioners may be asked to provide a medical certificate regarding impotency, regarding virginity, regarding fertility, or sexual capacity in divorce. Such certificates should be issued cautiously, objectively, and only after proper evaluation, as they may have serious legal consequences. Don't haphazardly issue the certificate until unless you have all the documentation. About minors and vulnerable population, there is a special consideration in this POCSO Act of 3.12 compliance. POCSO means prevention of child sexual mandatory reporting obligations, explicit guardian consent for all procedures, age verification protocols, specialized documentation requirement for minor under 18 years. Another act, TRP Act 2019, Transgender Rights Protection Act. In this Transgender Rights Protection Act, it mandates non-discrimination, equal access to healthcare services, and respect for gender identity in medical practice. Sexuality practice guidelines, consultation in sexual medicine consultation, mandatory CHOPON policies, same-sex examiner preferences, and detailed counseling documentation. This is for minor and vulnerable population. Cases involving minors, mandatory reporting of child sexual abuse as per POCSO Act in India or similar laws elsewhere. All sexual abuse of POCSO Act should be reported to the government. Counseling minors about sexuality requires parental involvement legally, but balancing confidentiality is a challenge for the doctors. Medical documentation. As all of you know that first proper consent, then Privacy Act, then Documentation Act, all we have gone through. Then medical documentation is also, it should be clear, detailed notes of history findings, advice and consent should be there. There are use of standard questionnaires, IIEF for erectile dysfunction. IIEF means International Index for Erectile Function, and accordingly there are some questionnaires which are asked, and accordingly we rate whether it has very low, high, and accordingly we give the marks. And this is very important for medical documentation. Such type of standard questionnaires is there for all sexual dysfunctions. Forensic and legal testimony. In forensic and in court of law, sexologists may be called as the expert witness. As all of you know, the expert witness, whenever called in the court, his decision has to be followed by the judge also. So there is a difference between normal witness and expert witness. And sexologists may be called in this court as a witness, as an expert witness for impotence, sexual dysfunctions, rape, sexual assault, evaluation, gender identity, as a subject. Expert testimony must be evidence-based and not unbiased. Documentation and record keeping. In sexuality practice, you have to keep the all documentations regarding consent, Privacy Act, whatever is to be kept. If you have kept properly, then you are not sued in the court of law, otherwise they may call you in the court of law. Legal requirement for record keeping. Accurate, detailed records are legally required and support quality care, and they aid in legal defense and continuity of care. Components of documents should include clinical notes, consent forms, and communication logs also. Benefits proper record keeping. It also supports the delivery of consistent and high quality care. Telemedicine and sexuality law. As we are in the age of AI, which now this is the branch which is growing, but there are benefits and some challenges when doing telemedicine in sexuality. Telemedicine, expanding access to telemedicine, expand access but introduces regulatory complexities, navigated cross jurisdictional rules, specifically if any patient from America concerning to India, then there is a differential law between America and India about the sexuality law. So you should know all these things. Privacy and informed consent are the challenges. So in future, the challenges may overcome. So now, because this is the era of AI, so we have to learn the telemedicine and sexuality law also. This is a case which I want to discuss to you. How patient do the allegation and how doctor defends strategy should be. This is a case I took post-nasal burn incident. This is patient's claim. This post-nasal burn incident. Inadequate pre-treatment patch testing. Patient alleging that they have not done my patch testing. Unrealistic promises doctor has given. An outcome and side effects leading to the unexpected burn injury. This is the allegation made by the patient in the court of law against the doctor. Then what is our strategy? This is the defense strategy of a doctor.
This I am telling you this example, and such type of allegations and defense strategy in sexology, dermatology, cosmetology, all available. So for defense strategy, comprehensive patch test documentation. Before going for each and every laser, just go for a patch test of single shot of the hand. Take it proper documentation, online proper documentation, detailed informed consent counseling, and explain about them about the pH risk patterns, skin types, and all protocols should follow. So if this is our defense strategy, and if this is the allegation, then this allegation won't be accepted by the court of law. What is the key learning in this? Practice improvements, enhance expectation settings, detailed risk pattern type documentation, comprehensive and instruction sheets, and follow-up communication protocols. By this, I just wanted to give the message that whatever the allegations are there, be prepared to have your defense strategy. This is a landmark case, Samira Puri 208 and Dr. Jacob Method 205. These are the two cases which I want to discuss because these are not much related to sexuality, but what is blanket consent? This I want to explain to you. This is Samira Puri case. This is Samira Puri case of 2008. She was a fertile woman. She has some excessive bleeding problem. She has consulted doctor advised hysteroscopy, and at the time of the hysteroscopy, they found some endometriosis, and they have decided that her uterus to be removed and her ovaries to be removed. They have just given that consent to their parents. Samira was not knowing anything because before taking to her on this, they have not informed. They have just told that we are doing the hysteroscopy, and they taking informing their parents, they have removed this. And when she came to know that her uterus and her ovaries are no more, then she has sued the case against that. And such type of blanket consent are not accepted. So while doing this, you have to explain everything to the patient. The patient is a major patient, not in case of minor. The patient was major, you are a fertile patient, and her uterus and ovaries are removed without informing her, but to inform the father. Also, such type of blanket consent is not acceptable. Another is the Dr. Jacob Method case of 205. In this, that criminal negligence requires gross negligence. There are two types of negligence. Criminal in case of when they are taking the doctor into the jail, that such type of criminal negligence required gross negligence. Then and then only. In this case, doctor was an intensivist. He was treating a critical patient with oxygen. He has started oxygen therapy to the patient, but further that it was found that the oxygen cylinders which were there, they were empty. They think that the oxygen is going on, but the oxygen cylinders were empty. The patient died. Then they sued Medico a case. Then court told that this is not the fault of doctor. Doctor, he was not knowing that the cylinder was empty, but that is the duty of the hospital management. So they have such type of criminal negligence. There is a requirement of gross negligence, not such type of negligence. I just want to share one example as for the doctor. Intention. There are two people in front of you. One is a doctor. One is a murderer. What doctor do? He takes the knife. He opens the abdomen. But his intention is to save the patient. He is opening the abdomen. He is opening the abdomen with a knife. But his intention is to save the patient. What murderer do? He also takes the knife. He will open the abdomen. But his intention is to kill the patient. So intention play a vital role in medical care. And the doctor's intention is always to do something with the patient with the intention to give him a good health. So in summarize, this is the medical checklist for sexuality practice. Which are the areas, what to do and what is to be avoided. For example, consent, what to do, what to be avoided. In confidentiality, what to do, what to be avoided. This slide I will share with all of you on your WhatsApps. So just this is very small words, you can read this also. This is the professional boundaries, what to do, what to be avoided. In medication and therapy, all this. This is the checklist of all our sexuality talk. So thank you very much. This I just want to do the good practice, but at the same time aware of the situation, aware of the society, make it clear, talk with the patients, and whatever if you are doing in the medical occupation, you may never come to the court of law. Thank you.